I'm so excited to be here. And we're both live streaming on Facebook and we're recording this session. And so, Meg, set the stage and then we'll do a little short round of introductions.
Absolutely. So today we've got Miss Karen, who's going to talk us through things that people should know about the flu and things that people should know about the flu vaccine, and answer any questions that you have. If you're watching it live, you can always drop those questions in the chat on Facebook and I will convey them. But yeah, let's get going.
Okay, and so let's introduce our trainees. Willie Lightfoot, you want to go first? Let us know where you are, your full name, and the name of your shop.
Yes, how you doing, Dr. T and family and Karen? It's a pleasure and honor to be here. My name is Willie Lightfoot, master barber and barber examiner for New York State. I'm here in Rochester, New York, and the name of my shop is New Creations Unisex Shop.
Very, very good. And we have Katrina Randolph here. She's a wellness warrior and a certified community health worker. Katrina?
Yes, hello everyone. My name is Katrina Randolph. I'm the owner of Trey Shades Hair Studio in Capitol Heights, Maryland. I'm also part of the Hair Network founded by Dr. Stephen Thomas. And I'm also a certified community health worker through the state.
Amazing. So glad to have you here. And you go on mute. And our content expert is Karen. Karen, pronounce your full name, title, and everything for us and what we're going to do today.
Hello, thank you so much for having me. My name is Karen Lagarda. I am a nurse with Luminous Health. We have AMC and DCMC if you guys are familiar with it. So I've worked a few years at the hospital, and now I am part of the community health improvement team at the hospital, where we do a lot of community preventative and education programs all around the Anne Arundel and Prince George community.
Now, Miss Karen, just before I turn the floor over to you, I have to give a shout out to Luminous. So AMC Anne Arundel Medical Center and Doctors Community Hospital are now one, Luminous Health.
Yes.
And the reason I love that name, because it means light. Our first vaccine clinic in a beauty salon, it was Luminous Health that delivered the vaccine in Katrina's shop, right, Katrina? Some snaps for Luminous. And for the very first barbershop, Willie, here in Maryland, it was Luminous Health that was there as well. So Luminous has been our clinical partner, and I'm so glad that you could be here representing them for the flu training today. And with that, I'll turn the floor over to Karen.
All right. Well, yes, it was probably our team that was hosting that clinic. So we've been putting shots in people's arms for a very long time now. And like you said, we do it in churches, low income housing. So I love to hear that. So basically, I'm going to try to give a very basic, and then you guys ask questions. Flu is a very contagious viral illness that the season is around October and goes as far as May. So it is very common in this area. It can cause things as low as runny nose, body aches, chills, headaches, but it can cause severe illness, which is what we worry about and why we really push vaccination, which is pneumonia. It can cause inflammation of the lungs, the heart, the brain, sepsis, which is an infection all over the bloodstream. And that's really what we worry about and why we push getting vaccinated. Vaccinations can prevent the flu 40 to 60%. It is pretty broad. The range depends on the person and the vaccine, but it is about 40 to 60% preventative in helping you not get the flu. And if you do get it, in not getting severe illness from the flu. So that's why we really push it. Really, in our age groups that are at risk are those that have conditions that make them immunocompromised or have diabetes or heart conditions. Also, our group 65 and older is very at risk of getting the flu and getting severe illness from it. And our youngins, so those children 2 years and under, and our pregnant women population. So a lot of times we say you might not be worried about getting the flu. You might be in the bed for 2 to 4 days, but everybody has somebody that in their family or neighbor or in their community that is 65 years and older, children, a pregnant person, or somebody with a chronic condition that can be one of those that end up being hospitalized or getting severe illness such as pneumonia. And we really, as a community, have to help protect those that are more at risk. So yes, any other questions?
I think you summed it all up for me. All the questions that my staff had, you pretty much answered them all.
So let's do this as we kind of go back in and edit this. Take a question from kind of set the stage, Katrina, and say, I have one of my staff people, and they've asked this question. Then ask the exact question, and then Miss Karen will answer. And that way we can have this as we move along.
Okay, so one of the questions one of my staff members had is, if you get the flu vaccine, why can you still catch the flu?
So there's a number of reasons why somebody can get the flu vaccine and still get the flu. So we have, similar to COVID, unfortunately, there's so many different types of flu out there, over 100. So we have researchers, scientists working all year looking at what are the prevalent strains of flu. So what we actually give is a flu shot, and it's called quadrivalent. So it's a flu shot that protects you against 4 strains of the flu, which is what they've summed up to be the most likely strains that will hit the community. So the reason why you still might get the flu is because maybe you got a strain that wasn't in that flu shot. 2, it actually takes 2 weeks for your body to gain the full immunity against the flu. So you actually might have been exposed the day before getting the flu shot. And unfortunately, within those 2 weeks, you were exposed and you did get the flu. And a lot of host of other reasons why different people don't get as much immunity. Our group 65 and older, sometimes it's recommended they get a super flu shot, which is a stronger dose. So that's kind of many reasons why you can still get the flu, even though you get your flu shot. And really what we recommend is try to get your flu shot every year, because with every year that you get it, you're being vaccinated against different strains. And every year your body's gaining more and more immunity towards those strains and many different strains. So if you're getting vaccinated every year for 10 years, you are very much protected against the flu season and all the different strains that come around.
Okay, great.
Now, Katrina,
Yes.
I sent you a text, and you can take a look at the questions, and I'm gonna ask now Willie the same thing. Willie, either a question that you have or something you've heard from the chair, doesn't matter how complex or how simple. You ask the question, and then Karen will answer, and that way we can have this for post-production. Unmute yourself, buddy.
I don't have that. Are you sending those questions to me as well?
Yeah, I will. But right now, just pull right from what you've heard in the barbershop.
Oh, okay. Thank you. Yes. Well, one of the things that I've heard, not only in my barbershop, but I'm also a pastor for a church, and I have a very senior congregation. And I heard you say that people that are a certain age that are more senior are more susceptible with this virus. So my question would be that I've heard in both settings is, why are the seniors more accessible, and or what is it that potentially can happen to them as it relates to capturing the virus as opposed to someone much younger?
Yeah, so unfortunately, it does have to do with age group, those little babies that don't have as much immunity. And then our group 65 and older. A lot of times when you're 65 and older, your body isn't as well as protecting you from things from when you're like 20 to 60. Really, you have a lot of chronic conditions you may have. A lot of 20 to 30-year-olds may not have diabetes, heart conditions, high cholesterol, but when you start hitting 65, you have a much higher rate of having those conditions. And it really comes down to there are more at-risk population. Unfortunately, we've seen it with COVID. We've seen it with a lot of other illnesses. It hits them a lot stronger. Their body is just not that well of, getting a cold, and we may be able to push it off, but they really get hit pretty hard. Kind of how the inflammation works in their body, it kind of goes into overdrive. So their lungs really feel it, and they feel it for much longer than we do. Yeah.
Part two to that question. Thank you, Karen. And you kind of answered this before. It was kind of asked a different way, but we hear this, and I hear this all the time from my clients in my barbershop, and from the staff that works in my shop, that taking the flu vaccine is going to give me the flu.
Yes, we hear that a lot as well. And that is a big myth. The flu shot can not give you the flu. It no longer is what we call a live vaccine where it actually carries the flu shot. It cannot, but some people can have the headache, the soreness, the body aches, even a fever from the flu shot, because their body is kind of gaining the antibodies to fight off if they see the flu. And that happening in your body can kind of make you feel like I'm kind of sick. I kind of need to rest. I feel fatigued, but it's actually your body doing what it's supposed to do to fight the flu. And I always tell my people, if you've had the flu, you'll know that having a little bit of body aches, being a little bit fatigued the next day cannot compare to being out for about a week with the flu. So even though it doesn't feel good, I always tell them, believe me, it cannot give you the flu. And if they do get the flu, unfortunately, I tell them you can't get the immunity within 2 weeks. So you might have been exposed, and unfortunately, within those 2 weeks, you got the flu.
Can I keep going, Doc? Because I got a lot of questions.
Yeah, keep
I don't want to hog up from Katrina. I don't want to hog the mic here, but
Katrina's getting ready.
And then I'll
I
yield.
I just had one other question really quick.
But hold on, Katrina. We'll and just line your questions up, because I want you to have more than just one more. Okay.
Okay.
So Willie, you go ahead.
So
We'll do this segment like one-on-one with Karen. We got Willie, Barber, then we got Katrina, stylist. So go ahead, Willie.
Okay.
So my next question would be, as it relates to us as wellness warriors, we've been pushing and educating folks around the COVID-19 vaccination. So we've had quite a few people who come to our shops. They've gotten the COVID-19 vaccination. They've gotten both shots, boosters. So now a lot of us, we're talking to the same population, the same clients. So how does the flu shot work with having all three vaccinations of the COVID-19 vaccination? Is there a time frame that they have to wait before they can get another flu vaccination, or is it okay for them? How soon can they? And is there any interaction between or reaction between the flu vaccine and the COVID-19 vaccination?
So that's a really great question that we get a lot. So you can actually get your COVID vaccine and your flu vaccine at the same time. So we actually have in our clinics, we do vaccinate with the COVID vaccine in one arm and the flu vaccine in the other arm. And you can actually do the same arm, but kind of separate it by a little bit. And really, studies have shown that they have not seen an increased reaction if you get two vaccines instead of just one vaccine. So it's pretty similar symptoms the next day, which is the same fatigue, body aches, maybe a mild fever, So same symptoms, and it is safe. I kind of tell my patients, it's kind of like taking a diabetes medication and a cholesterol medication. They're perfectly fine to take together. Your body is processing that medication. So there's no indication that you cannot get both vaccines at the same time. We just recommend to stay really hydrated that night just to help your body process that vaccine.
Good question, Willie. Good question. Now, don't go far. We're going to bring Katrina up for a few, and then we're going to bring you back, Willie. Okay, Katrina, one-on-one with Karen from the salons. Hold on, you're muted. You're muted. You're muted.
I said Willie that asked about all the questions that I had, but one of the other questions that one of my clients asked, she had got the flu vaccine and she got really, really sick from it like a month later. And I wanted to know, normally when that happens, what should you do?
So I would probably recommend to have a one-on-one conversation with her. I don't
Okay.
know if she does have a doctor, but a lot of times if you got a flu shot, you would have symptoms minutes to hours after getting the flu shot. So my question to her would be, could she have come in contact with the cold? Could she have come in contact with COVID? Exactly what were those symptoms that she experienced? Was it until a month later, or was it right after that kind of proceeded within a month? So those would be my questions to her, based on that, and to really be able to decide, was it the flu vaccine or was it potentially something else?
Okay. Let's see. I have another client that has a respiratory disorder, and she was hesitant to get the flu vaccine. So I told her I would find out information for her. I believe that it would be good if she still get the flu shot, but she was afraid of getting the flu shot.
Yeah, that's a very good question. So for her, I would actually extra recommend that she got the flu shot, because the flu shot is a very, very safe vaccine. It's been given over 50 years. It's been given to millions of people. So there's a lot of research out there to show it's a very safe, with only mild symptoms such as the fatigue. However, flu, especially with her having that history of respiratory illness, she would be very at risk from developing pneumonia or a very bad inflammation of the lungs, that she could very well end up hospitalized from the flu. So I would really, really recommend for her to get her flu shot.
Okay, great. Okay, so those were the two questions I had.
Hold on, Katrina. When you hear people with respiratory conditions in your salon,
Mhm.
what kind of respiratory conditions? And just kind of set it up and talk to Karen about, here are examples of respiratory conditions that I see in my shop.
I think hers is, I think she has some type of inflammation of the lungs because she used to smoke. So a lot of times when she come into the salon, I can't use certain aerosols when I'm doing her hair because it will make her cough. So a lot of times I turn on the air ventilation system and I do her hair without any aerosol sprays or anything of that nature.
Yeah, so some of our patients that I would definitely recommend that I have seen respiratory illness would be asthma. They're very much at risk of getting severe flu illness, bronchitis, COPD, emphysema. So and for her, it could sound like she would have one of those. So I would definitely recommend, because if aerosolization and those chemicals can harm, having a respiratory virus in her lungs would definitely put her at risk of flaring up her condition.
Okay, great. I'll definitely share that information with her. Thank you.
Okay, we're going to bring Willie back with some questions from the barbershop.
Yes, I have three. And the first one is, because I hear this, and I'm sure Katrina hears this a lot, is I've never caught the flu. I've never caught the flu. You don't need to take no flu shot, you know. So what are the statistics around people like that who catch it, who don't, or has everyone caught some form of the flu and they just may think it's a common cold? But I've heard people say, I've never had the flu, never had a flu shot, so you don't need to take it.
Yeah, so a lot of people probably have gotten the flu, but they were able. So the flu, it kind of is from 5 to 7 days that you have symptoms, and a lot of healthy people can actually not be very symptomatic, and you can just think that it's the common cold. So the fever, the body aches and stuff. But I always tell them, hey, do you have a child under 2? Do you have somebody 65 years and older? Do you have anybody with chronic conditions, immunocompromised? And a lot of them will say yes. So I'm like, it's not only for you, but it's for those around you that you really have to be safe for. And the flu and illnesses caused by the flu it ranges from the 8th to the 9th leading cause of death in the United States and in Maryland. So it's actually way more prevalent than we think it is. And especially right now with everything going on with COVID, you might not die from it, but you definitely don't want to go to the doctor's office, or you avoid a hospitalization if you can right now. And right now, last year was actually a very, very low flu season. But thankfully, once we're reaching hopefully an endemic, looking past COVID, and those masks start coming off, we're going to start hugging each other again, being closer. We're really expecting for flu to spike up again.
Okay, I think you just kind of touched on one of my questions about the masking.
Go ahead and do it anyway.
Yeah, does that the masking, does that keep down potentially the spread of flu for us as barbershop, owners, and who are working in this space where we're working very closely to people? And you said that it was very low last year. Is that because of the masking?
Yeah, so we saw a record-breaking low flu season last year, and that was really because the flu is contagious, but we actually found that COVID is way more contagious than the flu. So everybody kind of put those masks on, were extra vigilant about washing their hands, coughing into their elbow, and that really helped keep the flu numbers very, very low, which showed us that it is very contagious, but all these things that we put in place really help decrease the flu by a lot. We hope that we can continue to a certain extent, pushing that, washing our hands, sneezing into our elbow. And if people were sick, they were quarantining, so they weren't going out, and they very well could have had the flu. And other times people will still work and go to school. And with COVID, you had any of these symptoms, you were quarantining. But looking towards the future, probably these things will start to fall out and flu will spike back up again.
2 more questions, Dr. T, if allowed. I don't know.
Absolutely.
I've been to Katrina, if that's okay. I don't want to.
Oh,
Go right ahead. Go right ahead. I'm
She's-
taking notes.
She's coming up next.
Okay.
Yeah.
So my next question would, how long does the immunity last? Because I heard you speak about 10 years if you've been getting shots for it. Me, I'm a retired firefighter, so I've been getting the flu shot. We kind of were really encouraged to get them because of the field that I'm in. And so you said something about 10 years. So we've been getting it for 10 years or more. Does that make you more stronger, shielded against flu than others?
It does. So we definitely recommend getting it every year. One, because the immunity does decrease over time. So that 1 year mark, your immunity starts to fall off. So we recommend every year. Also, because those scientists are studying which strains are going to be around us within that time frame. So it's important because maybe the flu shot you got last year isn't going to protect you against the strains that are coming this year, since there's thousands of strains. So we really recommend every year, but with every year that you get it, you're gaining more and more immunity. So the longer you can get your flu shot, the better it is for your body, and gaining that protection so that when you get exposed, your body catches that's the flu and they get rid of it very quick.
You got another one, Willie?
I'm going to yield to Katrina.
Okay, let's get back to the salons.
Okay, so Karen, what if you haven't had a common cold or the flu in over 30 years? Does that mean you have a stronger immune system against this against viruses?
It definitely can. If you've never gotten the common cold or a virus for a couple years, it could very well mean you have a very good immune system. I always recommend getting the vaccines, but I also recommend the hand washing, the eating your fruits and vegetables, getting sunlight, getting good sleep. So all of that stuff can help you get a very good immune system to fight off those things. But I think we've all seen, especially if you have little ones in the house, it's hard to not get something because they just have boogers all over the place. They go to school, they come back. Every mom I know of anybody 3 years and younger, someone's sick in their house constantly.
Mhm.
But so times change, those things that you're exposed to change. But definitely, if you haven't gotten sick at all in over 30 years, I want to see what you're doing because I want to incorporate that in my life too.
So I'm gonna give some snaps on that because raising my children, like in my house, if my children get sick, my husband gets sick of any type of cold or flu virus, I never get sick. The entire time of raising my kids over 21 years, I've never had a cold or any kind of virus. So that was one of the reasons I asked that question.
Yeah.
So another question I had was, can you spread the flu? Is it contagious?
Yeah, so it's very contagious. You can spread the flu one day before having any symptoms and up to 7 days after onset of symptoms. So it's actually more, the contagion period lasts longer than sometimes COVID can. So it is very contagious.
Okay. So I think that's it for me.
So let's bring everybody back to the Hollywood Squares. And I'm going to ask Karen, you've now heard from our lead wellness warriors. And many of the questions that they've raised are common questions that we hear in the community. And let's come to the Hollywood Square, Meg. And but you're in the clinical world. And so I'm curious as to what questions you're hearing that our warriors have not asked.
You guys covered a lot of them. I would definitely say can you have the flu vaccine with the COVID vaccine? Yes, you can. That the flu shot cannot give you the flu is a big one.
Pregnant moms should take the flu shot?
Pregnant moms definitely should get vaccinated. They're at risk of getting the flu or severe illness from the flu. So we definitely recommend it for pregnant moms. And in fact, even not to merge the two, but also with the flu shot and with the COVID vaccine, there's actually been studies done that when the mom gets the flu shot or the COVID vaccine, it can actually pass some of that immunity to the baby. So when the baby comes out, they then can have some immunity if they're exposed to the flu or COVID. So we definitely recommend it for them as well. And the flu shot is safe for anybody 6 months and older can actually get vaccinated with the flu shot. So
very, very good. And Meg, just to put a bow on it, are there questions that we've heard in our town halls or other places that we want Karen to respond to?
Yeah. So one that are there any vaccines anymore that you do get the live virus like normally?
So there are still the live flu vaccines, and those would normally be given at a doctor's office. A lot of times there's certain considerations with the flu shot that some people cannot get it. We've seen certain people with egg allergy, there's certain vaccines for them. Certain people that have allergic components, we recommend maybe one of the live activated vaccines, but that would normally be given at a doctor's office.
So
Okay.
knowing your status really is important. Having a medical home is really important. And when they come to the barbershops and salons, for Willie and Katrina and the other wellness warriors, to have a Karen to call, to have somebody you can pick up the phone and call And Karen, how important is it to be able to pick up the phone and call your local pharmacist for questions like we're having today?
Very important. In fact, you can walk into CVS and Walgreens. A lot of people don't know pharmacists are such a wealth of knowledge when it comes to your medications and the vaccines. And I strongly encourage anybody, use your pharmacist. If you have a question about your medications that you're concerned about, ask them. They are the number one people to ask about that.
So we're going to work on bringing pharmacists in as content experts for you wellness warriors. They want to be full-fledged health professionals, not just distributing, your prescriptions. And they're also willing to come out on site to your shops to actually deliver the flu vaccine and maybe other vaccines for diseases that can be prevented.
Yeah, I definitely just lost my train of thought for a second, but recommend that. Also, Luminous Health, we feel free. I will leave my email in the chat box. So we're always very, very willing to host a vaccine clinic in Anne Arundel County and Prince George County. So we give COVID vaccines and flu vaccines, even though the season's starting to end. And if there's people, we come with barriers when it's underinsured, but if there are those people that really, really, really don't like shots, there is a nasal spray flu shot that we can give out as well that I recommend people going to their doctors. If it's a, I am not getting my flu shot because I hate shots, I would recommend getting the nasal spray flu shot.
Okay, let's do this. So Katrina, I'm gonna let you ask the question, Katrina. Ask Karen, and I'm doing this so that we can edit later. Ask Karen about what about if people are afraid of needles? How can they get the flu shot? Ask her that.
Okay. So Karen, if someone is afraid of getting needles in the arm, what do you recommend as far as the flu shot is concerned?
So I recommend that they go to their doctor's office and explain that they're very needle hesitant, and there are flu shots that are given through a nasal spray. So it's not a shot; it's a nasal spray that is the flu vaccine through that form. Yeah, and distraction is very good. I mean, we have a lot of distraction methods. But I always tell people it's just like a strong pinch, the flu vaccine. It really doesn't hurt much. And you can always ask, can you give me the smallest needle possible for that flu vaccine? Because there's different sizes. So you can always ask. It's still appropriate, but on the smaller end of that scale.
Okay. So can a person taking chemotherapy get the flu shot?
Yes, and we definitely recommend that they get the shot because getting chemotherapy unfortunately washes out a lot of their immune response. They're very susceptible to pneumonia, to many, many illnesses. So having that extra flu vaccine to protect them against the flu season is highly recommended.
Okay, so I have one other question. If a person is diagnosed with the flu virus, how long should they wait before they come back into the salon to have a service rendered?
So they should wait at least 7 days and until their symptoms have minimized. There are flu medication that you can get if you go to the doctor's office, like Tamiflu and other ones, to help kind of reduce your sickness phase that can help you. But I would definitely recommend at least 7 days, even if they feel good after 2. Wait it out. And now that with COVID, we've seen really great recommendations. If you go out, wear your mask out for an extra 2 days.
Okay.
So go ahead and mute Katrina. And
okay,
really,
I have one other question. Dr.
That's even
Thomas.
better. Go ahead.
Okay. So how does the Tamiflu works? Am I saying it right?
Yes.
Okay.
So Tamiflu, that would be a great question for a pharmacist because I'm not an expert in the Tamiflu, but it kind of can prevent your symptomatic phase. So the great thing with Tamiflu is to start taking it early as you can. Unfortunately, once you're already a couple days, it won't really be that effective, but it can really help in minimizing the amount of days that you're sick for. And so that you are not as, you can't be as contagious for as long. So it kind of can just make the illness a little bit shorter and a little bit more mild.
Okay, great.
So-
Okay, Dr. Thomas, I'm done.
And one
Wow.
more thing. So the great thing about Tamiflu as well is that if, for example, your husband, your son, somebody very close to you got the flu, it had the flu, you can get your whole family to take Tamiflu to help prevent them from getting the flu shot from that person that is contagious in your household. So for that, it's very important. So if you go to the doctors and your flu tests come back positive, ask them for Tamiflu for your family.
Okay,
Willie?
thank you.
Oh, no, I think that all of my questions have been answered. It's been very informative.
So Katrina had a very good one as it related to Tamiflu, and go ahead and mute yourself if you're not talking, because that says, "Oh, I got the flu. I didn't get the flu shot. I got the flu. How can I make sure I don't end up in bed for a week?" Tamiflu. But I got to take it. How soon, Karen?
As soon as you can. So it's more preventative. So if your family member has the flu and they're positive, start taking it that day so it can prevent you from even getting the flu.
Okay. Now, these are folks who have businesses. You can't do 6 feet away. Maybe they can wear a mask. What recommendations should they have for their staff if they start having flu-like symptoms?
If they start having flu-like symptoms, definitely go and get tested. Get tested in today's society for the flu and COVID because they run so closely together, the flu symptoms and the COVID symptoms. And now really you have to follow the COVID guidelines. In pre-COVID, we would recommend hand washing, going to get tested. And if they come back negative, still wearing your mask, still coughing into your elbow and making sure you're not touching your nose and touching other areas as well.
So Willie, Katrina, and even Meg, having in the shops infographics about coughing in your elbow, hand sanitation, even masks, to still have those things up because it helps stop the spread of other airborne diseases, and it works. Willie?
Can I ask a follow-up, Doc? Okay, so a couple of them that's in the chat that I think are very good to ask. How do I get tested for flu, and what are the flu symptoms?
So you get tested for the flu similar to how you get tested for COVID. It is a nasal swab, and you can really find a lot of COVID testing sites around, but for flu, you really do have to do it at an urgent care, a prompt care, at a doctor's office. And how you, the symptoms are so similar to that of COVID. It's really, it lives in the nose, the throat, and the lungs. So having a cough, itchy throat, having a lot of congestion, body aches, fever, very sleepy, fatigued. Those are runny nose. Those are all the flu-like symptoms.
Meg? So the barbershop and salon have people from the entire age range, including young moms with small children. Let's go to that upper age range, those seniors. You said the word quadrivalent.
Mm-hmm.
What is quadrivalent, and at what age should you be asking for the quadrivalent version of the flu shot?
So the quadrivalent is actually the flu shot that we're all getting from 6 months to the age of 65 we get what's called the quadrivalent vaccine. And that's the one that has the protection against the 4 strains. When you get 65 and older, it might be recommended, you can speak to your doctor about what they call the super flu dose, which is kind of like a higher and stronger dose of the flu shot, since they're so at risk. Kind of statistics wise, when you're 65 and older, it's 50% to 70% of that age group that end up being hospitalized or die from flu illness. So that's why they really recommend the stronger flu dose for them, which if you are going to a community vaccine clinic, you can always talk to, for example, the barbershop, which would then talk to who's bringing the vaccines and see if maybe they can bring one dose of the super dose, or going to your doctor's office and having a discussion with your doctor to see if maybe that would be the best decision for you.
Now let's go to the way other end of the spectrum, the little ones. What is the first age for eligibility to get the flu shot? And how important is it for the little ones to have their annual flu shot?
Yeah, so once you hit 6 months and from then on, you qualify to get the flu shot. And we definitely recommend the flu shot for the little ones. One, because school is such a breeding ground for the flu. Unfortunately, they also get other illnesses such as RSV.
Now go ahead and say what that means.
Respiratory syncytial virus. So that is another respiratory viral illness that's very common in that age group. And unfortunately, we've seen so many cases where they get all two or all three, and they're very at risk of not only getting the flu, but also getting the flu with RSV or the flu with COVID. So for all those moms out there, it's just an extra protection. It's already stressful enough when your little one gets sick with one illness, and to put on top of it other illnesses is just so worrisome. So
Willie, I'm gonna let you ask this one. Are the ask about the risk, side effects of the flu versus side effects of the flu shot? Which is worse? I'll let you ask her that one.
All right. So Karen, I'd like to ask you about the side effects of the flu versus the side effects of the flu vaccination. Which one is worse?
So which one is worse is definitely the flu illness. So from the flu illness, you can have the minor, which everybody mostly gets, which is the headache, the body sores, fatigue, runny nose from getting COVID, cough. And then you move on to complications from the flu or severe flu illness, which is then the pneumonia, which is an inflamed heart, which is an inflamed lungs, which can then be sepsis. So all these, it also can go into multi-organ failure when you get severe flu illness. And then from the flu shot, you can have, I've gotten my flu shot many times, and for the most part, the majority of people don't get many symptoms from the flu shot. It's way more common to get symptoms from the COVID vaccine, but a lot of times that's just headache, body aches on a very smaller scale, max 1 day to 2 days. And being honest, we do have bad side effects in a very, very, very low percentage of people from the flu shot. So from 1 to 2 in 100 million people will get that bad side effect, one of them being Guillain-Barré syndrome. It's very, very, very rare, but we always do want to be very clear with our community and say there is that risk, but like I said, it's so small, and that risk is there with every vaccine, with every medication out there, even with something as simple as Tylenol over the counter. There's that very, very, very small percentage of the population that does get that side effect, but your chance of getting severe illness from the flu is 100 times your risk of getting a bad side effect from the flu shot.
All right. Meg, what do you think? We covered the waterfront?
I had a question because you hear about the stomach flu. When you get the flu shot, does that prevent you, like help you from getting the stomach flu?
Yeah, so when a lot of people say the stomach flu, so very common now is for people actually to have vomiting or diarrhea when they get the flu as well. And getting the flu shot can prevent you from getting the flu. But if you do happen to get the flu, it can help you from getting a less severe sickness from the flu. So it can kind of minimize those symptoms. And it's kind of similar to the COVID vaccine, where you hear the COVID vaccine can prevent you from getting COVID, but more than that, it can also prevent you from getting severe COVID. So it's the same. A lot of people can have the flu now and function every day to day and just have minor symptoms.
Okay. Well, Karen, you have been wonderful today, breaking it down where we can understand it. And what we'll do is work this into a post-event edited Q&A with barbers and stylists. And I love it. We're bringing the light to you, Willie, and to you, Katrina. We're bringing the light to you through Luminous Health.
Absolutely.
Meg, you want to close this out?
All right. Thank you, everybody. This video is available on our Facebook Live. I will send it to all of you, and thank you so much.
Thank you
Thank
for having
you.
me.
Bye-bye.
Bye-bye.